right, so this is going to be part 1 for your chapter 16, future in pharmacy practice chapter in your pharmacy practice for technician textbook. So gaining experience. So during your pharmacy tech training, you're as a student, you're going to gain practical experience through externships. An externship is a temporary short-term student work experience. It is unpaid. And is usually arranged by your school as part of your program. Pharmacy technicians usually complete an externship in both retail and hospital pharmacy. That right now is kind of not happening for our students and our externs going out. The reason for that is the hospitals here in town are not accepting students. So we are doing our best to find you like a long-term care facility, pharmacy, and then a retail pharmacy. Some students are having to stay in retail for the entire 6 weeks. And unfortunately, it's just because of the COVID situation. The hospitals are not accepting students for the risk to the students themselves, but also the risk to the patients and other staff in the hospital of bringing in too many people from the outside. The preceptor is an experienced practitioner who instructs the student and assesses competence. So your preceptor, wherever you go, could either be a pharmacist or a lead or supervisor pharmacy technician. So some of the skills that they're assessing during externship, they're going to be looking at your ability to dispense, counting tablets. So this is why it's very important. I want you to be practicing this at home. Get beans, candy, anything that you can count. Use a butter knife and start counting. You need to be counting by fives very fluently to be very productive in your counting. Inventory, storage and control, making sure that you're putting medications back on the shelf where they belong, that you're rotating stock. Communication, how are you dealing with customers? How are you dealing with the rest of the staff in the facility? Documentation, error prevention and quality control, and then overall work ethic. Are you showing up to your externship on time? Are you showing up early? Are you staying the entire time that you're scheduled? Are you showing up in proper attire? Are you wearing your badge? Those things are all accounted for. Internship is a little different, is a worker that is hired to do an entry-level duty. So typically internships would be for pharmacist students. They get the internship, so that is a paid position. They work basically as an apprentice in training. Techs in training sometimes get these jobs by starting in another role in the same workplace. So prior to pharmacy tech programs being developed, most pharmacy technicians that have been technicians for a very long time, let's say probably late to early 90s, there wasn't many pharmacy tech programs available, so a lot did on-the-job training to learn how to become a pharmacy technician. Professional involvement is important. So there's ways to get involved with professional organizations. You can volunteer to serve on a committee. You can run for an office for different organizations, apply for membership, participate in your state's annual pharmacy legislative day. That's information is sent out from the State Board of Pharmacy, attending a conference. So there's a lot of different organizations that are going to put on different things for you to do. You can earn CEs or continuing education, and it just helps you be very involved in your field. It helps you keep up to date on the changes that are happening within our field, and so it's just really important that you at least join 1 to 2 of those organizations. So preparing for the exam. There's only 2 exams in existence that will get you certified as a pharmacy technician, where you will get the credentials of a certified pharmacy technician known as a CPHT. That is the Pharmacy Technician Certification Exam, or the PTCE, which is established by the Pharmacy Tech Certification Board, or PTCB. And then there's the exam for certification of pharmacy technicians, which is known as EXCPT. In the state of Arizona, we now accept both for certification. Prior to a couple years ago, state of Arizona did not accept the EXCPT, but now the State Board of Pharmacy accepts either or. We at Pima Medical Institute and myself and the instructors for the pharmacy program prefer the PTCE, and the reason for that is most of the employers here in town, especially the hospitals, are only really considering technicians who have been certified through the PTCE. So that's what we're sticking with, and that's what we're preparing you for. So the pharmacy technician certification exam is the PTCE. The PTCB is the Pharmacy Technician Certification Board. They establish and maintain criteria for certification and recertification on a national basis. It requires a background check, and it is accepted. This certification is accepted in all 50 states. It's not required, but it's accepted in all 50 states. Technicians who pass will receive the title CPHT, so you can put that after your name. Eligibility includes you must have graduated from high school or equivalent, so GED. You have to show proof of that. No felony history, period, and good standing with the State Board of Pharmacy. The exam for certification of pharmacy technicians, the EXCPT. This is established by the National Health Career Association. It encourages certification and provides examinations for many paraprofessionals. So they don't just develop the exam for pharmacy technicians, they do a lot. So like MAs, surgical techs, veterinary assistants, those type of thing. Eligibility is very similar to the PTCE with one addition. So this actually requires that you have completed a pharmacy tech program recognized by an institution within the 5 years, or have 1,200 hours of employer supervised pharmacy experience. Now, as of January 1st, 2020, the PTCE actually requires the same thing. So that was one win for us as pharmacy technicians. So prior to January 2020, you essentially could order a book online, sit for the exam, and become a certified pharmacy technician. That is no longer the case. Both certification exams require you to have gone through a program. Scheduling to take your PTCE. So you are going to apply online to their website. You are going to pay $129 is the fee. You're going to schedule the exam at a testing site in your area. Now, right now, because of COVID, they are also offering online testing. So those of you that are getting close to your externship, that's an option. The only thing is you must have, obviously, a working computer, but you also must have a working webcam because it will be a live online proctor who is watching you while you're taking the exam. If they see or hear anyone in the background, they will terminate your exam immediately. So the Williams Center here in town is the only test site open currently. There's a couple in normal circumstances, but that is the only one that is currently open, and they are obviously doing limited amount of people in at a time. So you do have two options. You are going to schedule it when you start to come to campus to do your skills checkoffs. We're making that a requirement that you schedule that exam, and then we're following up with you to see if you passed. So it takes a lot of work on your part. I give you some links. I give you a lot of study material. You got a book that I encourage you to read from front cover to back cover a couple of times before you take the exam. But overall, if you're really putting in the time to study, you will do just fine. So the exam is 90 questions, and it covers 9 areas. It lasts for an hour and 50 minutes, so 110 minutes. And the 9 areas covered are pharmacology for technicians, medication safety, inventory management, pharmacy law, pharmacy quality assurance, pharmacy billing, compounding, both sterile and non-sterile compounding, order entry and filling, and then pharmacy informatics systems. So when you apply, scheduling and taking the EXCPT, so you're going to apply online to their website. You're going to schedule to take the test at your school or at a testing center in your area. Our school does not do test sites. We can offer a computer, so you can come to our campus and use one of our laptops. We've had a couple students or graduates who have done that now because at the time the centers were all closed to do the online proctor. We are still allowing that, but you are not going to be scheduling your exams through this EXCPT. This is more just informational purposes because we go the route of the PTCE. So this exam is 100 questions. They give you 2 hours, and it only covers 3 main categories: regulations and tech duties, drugs and drug products, and the dispensing process. So that's why we push the PTCE versus the EXCPT. The PTCE covers 9 categories, so it's more in depth, and that's why the hospitals, especially here in town, prefer the PTCE. So we're going to go with what our employers are saying and prepare our students for that exam. It is a more well-rounded exam. It requires you to know more information, which is actually going to help you have a better foundation as a beginning pharmacy technician. So test prep, making sure you get a good night's sleep before the test. You want to eat before the test. You want to arrive early because you want to make sure that any traffic issues or you end up not sure exactly where the location is and you have to walk around a little bit and find it, or parking's an issue. You must bring a valid ID. Everything you bring with you is going to be stored in a locker during testing. No cell phones. They're going to make you take big bulky sweaters off. You're basically going in with nothing. The grading of the PTCE, so as soon as you finish your exam, you will get an unofficial result that is provided to you at the end of the test. You will get a preliminary pass or fail report. If that preliminary report says pass, you have passed. If that preliminary report says failed, you have failed. There's no, well, it says I failed, but I might have passed. No, the preliminary reports are actually right on. If your preliminary report says you passed, you did pass the exam. If it is failed, you did fail. You can take the exam up to 4 times. You will pay $129 each time you take it, and you must wait 60 days in between each attempt. So it's better to get it done and get it done quickly. And pass the first time. Recertification is required every 2 years for both certification, so PTCE and the EXCPT. It does require 20 hours of approved continuing education, known as CEs. So in that 2-year period, you must have 20 hours of continuing education. Typically, and this is a requirement for a PTCE, of those 20 hours, so 20 hours total, 1 hour must be pharmacy law, 1 hour must be patient safety. You can find CEs through professional organizations. That's another reason why it's important to join those. Some employers offer them, like Walgreens does. Professional journals and some college courses account for your continuing education. So when you're starting to prepare for your job search, you're going to be identifying your career goals. One thing that they suggest is interviewing pharmacists and technicians who work in different settings. So, if you're a regular customer of Walgreens or CVS where you pick up your prescriptions, interview them, ask them questions. How do they like it? What is, why did they choose retail versus hospital? Think about your own ambitions. Think about how the job balances with your personal life. So some pharmacies are 8 to 5. Most aren't. Most retails are 9 to 9, 8 to 9. And then the hospitals are 24 hours a day, 7 days a week. So if you think that you're going to waltz into a Monday through Friday, 8 to 5, no holidays, no weekends in this pharmacy field, you're in the wrong place. Okay? Identifying and researching your potential employers. So use services offered by your school's placement office, career services, right? Cindy is your go-to gal. She's fantastic. She's going to be the one that's placing you. She's going to be the one that is sending you job leads in addition to myself. She is there for you. That is what she does. She's there to get you hired in the job that you want. She's going to look over your resume. She's going to make changes to your resume to make it good, and highlight your strong points. And it's really important. We've had graduates in the past that just ignore her phone calls and then they call crying because they don't have a job. Well, that's what she's doing. Answer her phone calls, answer her emails. She's there to help you. She's going to get you hired very, very quickly. There's so many pharmacy jobs out there. Check the classified ads in the newspapers. I don't really think we use the newspapers anymore, so it would be more online, like Indeed.com, Glassdoor.com, searching Tucson pharmacy technician jobs. There's tons and tons of jobs out there. Explore career opportunities that are posted on job searches or even hospital websites. Contact pharmacy and hospital pharmacy associations. So again, just putting your feelers out there. But that's one of the things that Cindy in Career Services does for you. Okay, she's doing that legwork for you. So characteristics that our employees are looking for. They're looking for good communication skills, interpersonal skills, the ability to perform precise work under stress. No pharmacy that you're going to go to is going to be a non-stressful environment. You're going to be stressed. You're going to have time constraints. You're going to be moving quick from here to there. You're going to be multitasking. They want to know that you're dependable. Are you going to be showing up for your shifts? Are you going to be calling out all the time? Are you going to be showing up late? That's just not the place to be if you have those issues. And flexibility. Again, if you're thinking you're waltzing into an 8 to 5 Monday through Friday job, you are highly mistaken. Most pharmacies do not operate that way, especially if you have a desire to go into a hospital pharmacy. Establish a network. Tell everyone that you know that you're looking for a job. Ask supervisors and coworkers at your extern site. Ask them about job openings, right? So your externship is essentially an interview for 3 or 6 weeks, depending how long you're at that site. They are interviewing you that whole entire time, and are good students that have gone out and rocked it and have done amazing. As long as there's job openings, they hire them immediately. So think about that. When you go out to your extern site, it's a reflection of how you're going to be as an employee. So you don't want to ruin that. You want to do good, okay? Search for online openings. Be prepared to give a 30-second sales pitch about yourself, and then use resources like Facebook or LinkedIn for networking. We're going to pause there.